This is a muscle energy technique for the gluteus maximus. Start by flexing and externally rotating the patient's hip on the contralateral side. Place their ankle just above your iliac crest. You can then use your body and your hand to move the patient into more hip flexion. Stabilize the patient's ipsilateral leg by locking it down with the towel. This will stop their legs sliding off the table when going into greater degrees of hip flexion. Use your body to lean into the patient's leg to move them into hip flexion. The next step is to ask our patient to perform an isometric contraction against our resistance. This isometric contraction should be gentle at approximately 20% of their maximum force, and this should be held for between 7 to 10 seconds. Upon relaxation, we can passively move the patient's hip into a larger degree of hip flexion, and then we repeat the isometric contraction. This same technique can be progressed to include more horizontal adduction by moving their knee towards their opposite shoulder. We then ask the patient to perform the isometric contraction or ask them to place their leg back down on the table against our resistance. These isometric contractions can be performed between 3 to 5 repetitions over 7 to 10 seconds. We can also aim to improve hip external rotation. Passively assess the available external rotation at the hip and then use your body to leverage the patient into external rotation. You will then ask them to resist by pressing their ankle into your body, internally rotating their hip. Once again, holding this isometric contraction for 7 to 10 seconds. Upon relaxation, passively take the patient's hip into a greater degree of external rotation and then repeat the isometric contraction.